Dear viewers, now we shall discuss for pharmacokinetics, pharmacodynamics, dosage, dosage form, first-pass metabolism, efficacy, agonist, therapeutic dose, LD50, maintenance dose.
Pharmacokinetics. Pharmacokinetics means what body does with the drug. It deals with absorption, distribution, metabolism and excretion.
Pharmacodynamics. The study of the biochemical and physiological effect of drugs and their mechanism of action are called pharmacodynamics. It includes the mode of action and drug effects. Pharmacodynamics means what the drug does to the body. It deals with mode of action and therapeutic response. Like therapeutic effects, side effects and toxic effects.
Dose. Specific amount of a drug at one time to be taken. Like paracetamol 500 milligrams. Dosage. Frequency of administration and duration of dose. Like 3 times for 7 days.
Dosage form. In which form medicines to be administered like tablet, capsule, syrup, etc.
Types of dosage form. Solid dosage forms, tablet, capsules, suppository, etc. Liquid dosage forms, syrup, suspension, solution, injectable, etc. Semisolid dosage forms, cream, ointment, gel, etc. Gaseous dosage forms, inhaler, spray.
First-pass metabolism. First-pass metabolism is a phenomenon of drug metabolism whereby the concentration of a drug is greatly reduced before it reaches the systemic circulation. All the oral drugs after swallowed absorbed by the digestive system and enter the hepatic portal system. It is carried through the portal vein into the liver before it reaches the rest of the body. The liver metabolizes many drugs by hepatic enzymes, mainly CYTP450.
Significance of first-pass metabolism. The prodrug-like inactive drug is converted into active drug by first-pass metabolism, which helps in drug excretion. There are 2 factors that determine effect of a drug on physiologic processes. They are affinity and efficacy.
Affinity. It is the tendency of a drug to bind with receptor and the subsequent maintenance.
Efficacy. Efficacy is the ability to produce a desired amount of an effect after binding a receptor. Drugs that interact with receptors can be classified as agonists, antagonists.
Agonist. A drug which has both affinity for receptor and efficacy is called agonist. Like B2 agonist binds to beta receptors in the bronchial smooth muscle and increase the bronchodilation. Drugs bind at the same site as the endogenous ligand and produce the same signal. The signal is equal or less than that produced by the endogenous ligand. Drugs also may bind to a different on the extracellular side of the receptor, and enhanced response is produced when the endogenous ligand binds.
Classification of agonist. Agonists can be further divided into 2 types: full agonist and partial agonist.
Full agonist. Drugs that occupy receptors and bring about a full or maximal response is known as full agonist. Full agonists bind, have affinity for receptor, and activate a receptor, displaying full efficacy at that receptor.
Partial agonists. A drug which does not produce maximal effect even when all of the receptors are occupied. This is due to difference in efficacy. That is, these drugs are less powerful and 100% occupancy produces a lesser response.
Therapeutic dose. Dose required to produce optimal therapeutic effect is called therapeutic dose.
Lethal dose 50. LD50 is the dose that causes lethal effect in 50% of test animals.
Maintenance dose. Dose required for maintaining the desired effect that is achieved by preceding dose. Or, it is the amount of drug given in each dose at certain intervals to replace the drug eliminated since the preceding dose to maintain a steady state of drug in the body.